Welcome back to another episode of Rethink Healthcare. I'm Wendy Ball, and this is
Paul Montenegro.
Yay!
Yay! Better than that.
Yeah, I'm feeling a little tired today.
A little tired. Need some caffeine.
I need a Starbucks. Doesn't everybody need a Starbucks sometimes?
Yeah, we could use some. Maybe we'll go for one after the show.
Yeah, everybody needs a Starb sometime.
Yeah.
Yeah.
Was it Starb?
Starbs. I call it Starbs.
Starving for Starb?
I'm starving for Starbs. Yes. But I don't think we're here. I forget what we're here. I have no idea what we're here for.
Do you need some medications for your memory loss?
Maybe not medication, but maybe some confidence.
Are you lacking some confidence?
I might be lacking some confidence because I don't know what this episode is about.
It's about lack of confidence.
Oh, well, then I'm here. All right. So lack of confidence.
Okay, that's normal. It's part of life to not have confidence. The question is, what do you do about it?
Exactly. What do we do about it? I mean, anytime something's new, then you're gonna probably not have experience, so you're not gonna be as confident.
Well, I guess let's go through our own experiences and our own paths. How did we develop confidence in what we do?
Tell me, how did you develop confidence?
So for me, it's all about accepting that there's knowledge that I need to acquire. And once you establish and accept that, I need to acquire this body of knowledge so then I could execute and perform what is expected of me. Then you put out a plan. So how do I go about acquiring that body of knowledge? And then as I go through that, the more confidence I get.
Yeah.
So, like for example, from we have a lot of students here. From a schooling perspective, it's normal to be anxious. I got a test coming up, or I have this coming up that I'm anxious about. That's your first cue that you don't have enough knowledge in the subject matter. At least for me, right? And then my approach with that is, then now I have to then put the time in to get that knowledge in.
Yeah.
And then what I find is that as I put the time in, that's when I say, I feel better and better. Will you ever be to a point that you fully say, I got this, I got everything, I know it all? I mean, I don't think I'm ever at that point where you have 100% confidence you know everything.
No, I think we always have to be. I think if we're going to be good people, and especially good healthcare providers, we have to be teachable.
Oh yeah.
Always, because there's always something to learn. We can never have full knowledge of everything. So I think you're right. The first step is to have that knowledge. But now we have all this book knowledge, right? We've reached out, we've grabbed all this knowledge, we feel confident in the things that we've learned. What about when we're lacking confidence, not that we don't know it, but we haven't done something before?
The experience part. And any neophyte is going to go through that as well, because then there's no shortcut to experience. I mean, if you look at our education programs or the requirements for licensure, there's always a set number of hours required to be able to sit for a licensure exam, at least in the healthcare realm. Why do they do that? Because they know that they bake in the hours required, because they know that at least they would have had so much counted experience.
Because I don't want the cardiac surgeon to do heart surgery on me and have just read about it in the book and never really did it.
Yeah, they need so many they need so many surgeries that they would have performed, assisting, there's different roles within that. So I'm not sure the intricacies of those. I mean, for example, when I through nurse practitioner school, I had to, I think there was a requirement of 500 hours. I don't know the actual number of requirements, right? But for me, I really enjoyed what I did. So I actually tripled the amount of hours that was required, because from my perspective, and this is my own personal opinion on that, and luckily I had the time and liberty to do it, was the more experience I get out there while I have a mentor that I could refer to, the better I would be, then the more confident I would be when I get out. Then I have to make the decision by myself.
Yes.
Most of the time, not all the time, right? But most of the time. So, but I took that upon myself because I wanted to be confident when
I love that. I tell
you know?
my students kind of the same thing, in that maybe you've put in 20 Foleys or you've seen something done a zillion times, but you know, always taking that opportunity to just go in and watch something again or do something again, because you don't have that experience and something could arise different. So as much opportunity as you can to see something, to learn about something, to watch something, to be part of something, to perform something, to actually touch the equipment, that'll give you more confidence. So what do you do when you're out there, maybe you're a new student and you've done well in school, you did all your experience, you took everything that you could, all those experiences, but you're still lacking confidence. What do you do in that moment when you're lacking confidence?
So, I guess let's put it in context, right? So, for example, if let's say you're starting a new job, now that you're licensed, now you have a new job, but you haven't started yet, but then you're lacking confidence about this new job, right? So, a couple of tips that I could kind of think of is, keep in mind that the confidence is kind of within you, right? And it's a standard that you set upon yourself, right? So, usually the experience and exposure helps with that, right? But it's not all about the context of what you're doing. For example, if you're starting a new job at a new hospital, right? One way to kind of build your confidence about this new job that you have, right? Because you've already licensed, you've already done the work you could possibly do to get there.
You're already a nurse, sure.
Simple things will be, do a dry run driving to the hospital and back.
I like that.
Because then that way, right? Because the new experience is what sometimes triggers you to be not confident. So now, if it's a new location, right, and you do the drive, now that drive alone, if you do a test drive, it's not a new experience anymore.
Yeah, you're not anxious about that.
The next time around, right? Because then now I've seen those already. If you can even do a tour of the hospital ahead of time, do a tour, meet some of the staff ahead of time if possible. Because then that puts your mind, right? Now all those new experiences of a new setting, new people, if you meet them ahead of time, well, guess what? It's not new anymore. Then you could focus on the more clinical stuff at that point. And it's not just in job, I mean, even in competition. Like, I played tennis competitively before, and sometimes on a tournament, right? I would go to the court where I'll be playing just to
get a feel.
Yeah. Kind of feel like, okay, where's the sun at this point, at this time? How's the wind possibly like? Okay, where can I get my water? Where should I sit? Where's the bathroom? I mean, those things.
I know.
Those things matter, right? So then at that point, right, when I actually go to play the match, I've already had those checked off, so I could focus on the match as opposed to being the match saying, okay, where do I go for my bathroom break?
Yeah.
Where do I go? Oh, the sun's there. What do you think of that?
I love that point. I love the point of just kind of getting away all the other stuff, the extraneous stuff. So that's not like a burden on your shoulders.
Yeah.
And you can kind of relax about that, and you can kind of focus on your job a little more.
Yeah.
I always say too, if you're lacking confidence, and sometimes we're not going to be confident in, maybe there's something new that we're doing. I know Mr. Wound Nurse over here, when I went from the emergency room to home care, we're not putting wound vacs on in the emergency room, right?
Why?
So for me, I had been a nurse and I always tell my students, if you go from one area to another, you could be a nurse for a long time. I was a nurse 12, 13 years. And it's not that I wasn't a good nurse or had knowledge, but I just didn't have knowledge of wound vacs. So,
There is indication of wound vacs in emergency setting.
Are there?
Yeah.
Okay, maybe they're using them now, but they weren't.
No, well, since you mentioned that, right? Yes, I mean the negative pressure therapy is meant to granulate wounds, right? But if you think of what negative pressure therapy is it's a vacuum assisted closure, so it draws away the fluid on your crushing victims, wherein you have have lysis of the cells, and you have excess potassium being leached into the
They're using
circulatory
that in
system.
trauma.
You use the negative pressure to then absorb that excess potassium, so you're normalizing.
I wasn't in trauma.
Yeah,
But-
normalizing normalize the potassium levels. And really a good way to look at it is to also look at their urine. If their urine's clear, then you're doing your job.
But
A quick trauma tidbit.
his little
here.
side note here. But if you don't have confidence, I always say, get what you said, get the knowledge that you need. There's great resources out there, and don't ever be afraid to speak up. Don't just have somebody assume, oh, you've been a nurse for 15 years, 20 years, you know how to do this. If you don't know how to do something, then speak up and say, hey, I have been a nurse for 15, 20 years or however long, but I have never done that. Can you show me how to do that? So never do anything on a patient that you are not confident in or comfortable.
Yeah.
Get help if you need that help. And for new nurses, that might be more times than not, and that's okay, because we're learning, we're growing.
It's okay to say, I don't know.
Mm-hmm.
If you're truly honest and genuine about it, just says, I don't know, but let me figure it out, or let me work to find the answer, right? That's perfectly normal, because not all of us, a lot of times a patient of mine may ask me about something, and if I don't know the answer, I tell them flat out, I don't know. I'm gonna have to research it.
But you're confident in that it's okay
Yeah.
that you don't know,
Yeah.
right? We don't have to know everything. And being able to express that to your patients in a professional way that, that they still have confidence in you. I had a doctor that, would look up things, and I still felt confident in that physician because they were confident in themselves and confident in being able to get that information back.
Yeah, as long as if you're looking stuff up for the patient's benefit, I don't think they're going to question that. A couple times I looked something up because, hey, I just want to double check the dosing because this dosing seems a bit off, or I don't remember what the dose is. Let me look it up. So at least they know that, hey, they're not just guessing, they're like trying to reference what they're going to do.
Yeah. So I am confident now that this episode was about lack of confidence. Say, I agree.
I'm glad that
Yeah.
the discussion
Helped me,
Helped
right?
you.
Yeah, and I'm confident that after this, I'm gonna, in my hand, I'm gonna have
some
a
bucks.
chai latte. No, a Starbucks. I'm gonna have a Starbucks.
Starbucks.
Starbucks. I get it.
Okay, so you bring the bucks and we'll go to Starbucks to provide us the drinks.
That sounds good. So,
Thanks for tuning in,
Yep.
and we look forward to the next episode.
see you next time.